Aloha, welcome to Healthcare in Hawaii. I'm your host, Josh Green, Senator from the Big Island, Chair of the Health Committee. Today I'm joined by a good friend, Rachel Wong, who has just become our Director of Human Services here in the state of Hawaii. This is an important show because what the Department of Human Services does is extraordinary and expansive. I want to spend a lot of time getting to know Rachel today. I want you to get to know her because she is as central to health policy as anyone else in this state. So Rachel, welcome.
Thanks, Josh.
Good to see you.
I would say that, you're kind of central to health policy.
I'm just the sarcastic side of health policy. You guys are the doers. So let's see, you went to Princeton.
Yep.
You got a master's in public health.
Mm-hmm.
You got a PhD from North Carolina.
A DRPH.
DRPH.
Also public health. Yep.
You worked at the Healthcare Association
Mm-hmm.
as Vice President and Chief Operating Officer.
That's right. Yeah.
And so you've been involved in healthcare, but tell us a little bit about yourself professionally and personally so people can get to know you.
Sure. No, I appreciate this opportunity. Thank you.
Sure.
I'm born and raised here.
Great.
5th generation Chinese, which means I had to go to college to try to learn to speak Chinese.
Oh my God.
Came back and have been here ever since. And my background's a little different than most others. We all have our own personal stories.
Sure.
But mine, when you asked about career-wise, I feel like it didn't start till maybe 2004. And the reason is that, I was sick for a long time.
Okay.
So going off to school, was diagnosed with a chronic autoimmune condition, lupus, and slowly lost kidney function. So I have had these wonderful opportunities where I've had great education, great life, come back to Hawaii, but I've had the patient perspective.
My grandmother had lupus too. Yeah.
Wow.
So you had lupus, and I've heard, from you over the years about your story, and you're a big advocate for the Kidney Foundation type organizations, for organ donation. Tell us a little bit about that, because I think it's nice for people to know that you've seen it from the other side. You're now in this position where, and we'll get into this, but thousands of employees that are working with you at the Department of Human Services on health matters and survivable matters here in our state, but you actually were a patient. What was it like?
Well, and continue to be a patient.
Yes.
I think we all are, right? I mean, even you as a doc, right?
Yes.
You still have to go in and get checked up. You do,
I
right?
never get checked up, but I've had kidney stones twice, which was horrible. Yes.
Okay, so we're all patients at some point.
Yes.
And it really shows the interconnectivity that we have with our healthcare system, and more broadly than that, our larger system of services, that provide, whether it's assistance or healthcare or benefits to any of us.
Right.
So I think that's why I'm here. Yeah. It's my work having, I've worked at the Healthcare Association of Hawaii the 3 years prior.
Yes.
But before that, it was really with nonprofits in the community.
Right.
So my background is in public health. It's really been moving pieces in the community to affect policy change and to improve quality of life for others.
So this is a pretty extraordinary moment. You were nominated recently, a week or two ago, 3 weeks now? How long has it been?
I started a board almost 4 weeks ago. I stopped counting the days.
Yeah.
For a while I was counting the days, but no, I'm fully in, and I'm fully invested, and I'm very affirmed.
My gosh. See, so for our viewers, we in the state have the Department of Health and the Department of Human Services. And many people are familiar with the Department of Health, and they think that covers our hospitals and all of our health programs and so on. But I don't think what they're aware of is that the Department of Human Services provides an extraordinary amount of the health care for our state. I want to start back a little bit, though. You kind of had this professional period in the Healthcare Association. You were very impressive there. What kind of things did you work on at the Healthcare Association so people get an idea?
Sure, and at the Healthcare Association, HAH, was the organization that represents the hospitals, the nursing facilities, the home health agencies, hospices, and durable medical equipment suppliers.
Right.
And I worked real closely with all of our members, particularly those that were post-acute, so not the hospital members, but those in the community, right? And really to make sure that, that policy was set where quality care can be delivered.
Right.
Where rates are set, where quality care can be delivered. But most importantly, with the community health needs assessment that hospitals do.
Right. In fact, we've made reference on many occasions to the community health needs assessment here on this show. And to refresh people's memory, this was a very large project that really kind of painted the picture of where we do well and where we can do better in the state of Hawaii. What came of that? What were some of the big findings? Remind people.
Well, just as some background, it's a new requirement under the Affordable Care Act for hospitals, for nonprofit hospitals to follow. And it's for them to assess their community, to look at the different indicators there, how well in a community, however they define it, is doing, let's say, with diabetes or with education or transportation, so much more broadly than hospitals had thought of in the past. And to develop plans to improve those indicators over the next 3 years. And they had to attach this to their IRS 990 form. Okay. So it's a requirement every 3 years in perpetuity. Wow. So it's death, taxes, and community health needs assessments, right?
For sure.
Yeah.
That really, I think, sets you up very well. I hadn't been thinking in those terms before we were speaking today, but now that I think about it that way, that was an incredibly effective primer for you as you were going. I don't think we had this plan necessarily in place, but as you enter into the Department of Human Services executive position, that really, it's shown you the landscape. Do you feel comfortable as you, with this gigantic department, you had maybe you were working with 20 people or something over at Healthcare Association, and now you're working with, how many?
2,300 about.
2,300.
Yeah, it's a lot of people, yeah.
Is that it's got to be one of the largest departments in our state.
It is. It's the largest, I think it's the largest budget-wise, and we're in the top maybe 3 or 4 employee staff size-wise.
Amazing.
But so you asked this question, was it a good primer?
Yes.
I think working with HAH and doing the community health needs assessment gave me a broad perspective of what's going on throughout our islands, right? And in different geographic areas.
Right.
And also got me immersed in the healthcare system. Yeah. When I say healthcare system, I mean the delivery model. When I've entered DHS, as we call it, or the department, I realized how little I actually knew. And I'm still getting immersed, right? There's so many good people. When we talk about those 2,300 people, so many good people who are doing incredible work and with very limited resources. Yeah. Right? So with the things that we provide in DHS, when we think of healthcare in the interface, naturally there's the Medicaid department. So that's our MedQuest division. Okay. Right? This is providing insurance for people who are maybe blind, disabled, who are older, who are needy, right? So those who are living in socioeconomic strata, so
near poverty at the very least. And we've talked a lot about that on our program over the years. That's a large number now. It's 360,000.
I think we're 313,000.
Okay,
which is a huge increase.
It's a giant number of people, and that's in a relatively small state. I mean, we're talking again about maybe 1.3, 1.4 million people in our state. So almost 1 in 4 people rely on the services in your department to get some of their health care.
Yeah. I mean, we're a big provider in the coverage of healthcare insurance.
Yes.
But we also provide public assistance. So SNAP. Yes. Many people think of food stamps, but it's our SNAP program, right? Yes. EBT cards. It's the assistance. We have temporary assistance for families, for needy families.
That's TANF, is that right?
That's TANF, yeah. Okay. We provide general assistance. We provide assistance to families whose kids are in preschool. So it runs the gamut. So when we think healthcare, we're actually looking at broader health of our community. Yeah. Right. In public health, we use the term social determinants of health. Right. And the Federal Reserve Bank always uses the phrase, it's more important, your zip code is more important than your genetic code. So this is what we're talking about in DHS. We're looking at the fabrics of our community. Yeah, I'm so, it's really quite wonderful that you've taken on this role, because here in our Healthcare in Hawaii show, we've had, we've had Neil Palafox, and we've had, the leadership from JABSOM, and we've had the leadership from the Primary Care Association have often spoken in those terms. We've harkened back to today, which is great, to this idea of the zip code being more important than your genetic code. And that's a statement about poverty and economic capacity and just the challenges that people have today. But the Department of Human Services, I think of it as the blanket that lies over the entirety of all of these questions. It goes over the hospitals and the community health centers, and like you said, the food people can get, and sustenance, and it's just amazing the breadth of issues that you take. Now, how can you guys do it? I mean, you got one director, you. Yeah. Fortunately, you know a lot about many of these issues, and you've had some personal experiences that ground you. But how many deputies do you have? How many divisions? How many departments? How big is this department? Yeah, thanks for asking. We're one department with 4 divisions. Okay. We have 1 deputy, Pankaj Banot, who you know. Pankaj is a great character. Yes. I love him. And he brings so much institutional memory and expertise and the heart.
Yeah.
I think together, I think both of us were very complementary in our styles, but the heart, the values, the vision is the same.
Yeah.
And what we keep reaffirming to each other, it's about people.
Yeah.
Right? It's about the individuals and families whom we all serve.
Right. He's got a great personality. You'll have fun with Punk.
Yeah, no, we already are.
Yes.
We already are. And then we have the 4 divisions. So we talked about our MedQuest division that has Medicaid.
Right.
BESD.
Now Medicaid, so Medicaid's a big one. I mean, that's all these individuals in our state, all of our brothers and sisters that are in need. It's billions of dollars, right? It's a big program. So is that the biggest piece of Department of Human Services, or is that the wrong way to frame it?
I think it's hard. I think it's hard. We like to use metrics. We like to say, how much money are we drawing down from the federal side? How many people? I think it's intertwined.
Okay.
I mean, it's like you're already saying, right? The blanket above. I also think of it as the blanket below.
Yes.
Right. So we're all interconnected.
Like a sleeping bag.
Yeah, that's a good one. Okay, maybe I have to think about that and how to use that.
Okay, so you've got the Medicaid division. So that's one.
We have BESD, which is Benefits, Employment, and Social Support Services.
What comes under all that?
So that's SNAP, that's TANF, that's public assistance for preschool that we talked about.
Right.
There's Division of Vocational Rehab.
Okay.
So training, getting people back to work, whether you're, physically or mentally disabled, providing the support services for people to get back to work.
Right.
And then we have our Social Services Division. Right. So social services we think of, as Adult Protective Services, Child Welfare Services. And I know people read a lot about, these sensational cases in the media. And I want to reaffirm, just being here in the few weeks that I've been here, good people, so committed to their work. What we're reading about, what is sensationalized, is less than 1% of the cases out there.
Really?
Yeah, and that's not the story that's being told.
Yeah, it's very tough because that's right. We wake up in the morning, and I'm not faulting anyone, but the thing that shows up on the front page of the newspaper, unless I've done something crazy or David Ige has given his speech, is a tragedy, and it's a car accident or it's a child that's been hurt, and people read about that, and it's important. We know about these things, but like you said, it really is a very, very small piece of our day-to-day. There are thousands of success stories, I think, at the Department of Human Services and Health and Public Safety Department, all these places, for every tragedy that we read about, but there it goes. You see the tragedies.
Yeah, and you bring up a good point, though, that this is what we see, or people in the public, this is what they see. We in government, and I extend this to both of us now that I'm in government with you, I feel that part of our role is to unveil what happens behind the curtain.
Yeah.
Right? Because I've come from the outside and come in. Yes. And the eye-opening things for me to start to realize and understand the processes that go through, how decisions are made, how sound policies are created. People in the public, the providers, the community beneficiaries, whomever, they don't know about this. And that's one thing that I truly feel that our department has to do a better job of, and we're already starting to.
I think you're going to be very good at this because it is a communication problem for a lot of people, and a lot of people will say, "Oh, that's just the government," and they'll hear stories about, they'll read about the government took this child out of the family, or goodness knows what crazy ideas come out of the legislature, but you don't really get. It is hard to get the full scope of what's necessary, and the complexity of society is just amazing. I mean, a person that ends up in my ER, for instance, where I'm seeing them for that last moment, 1,000 things may have happened before they got there. They might have had a tragedy, and then there was depression, and then perhaps some substance abuse challenges, and they were poor, they lost their job, leading up to maybe that moment where they got very sick, or they had a car accident, or God forbid they tried to hurt themselves. So it's so complex, and there's so many ways that society can help, and sometimes it's government, and a lot of times these days when people need a little support, it is some service or another, and that's what you're in charge of.
Well, and that's what we collectively are doing. Government serves our community, right? And we're providing services and programs to help. Help is such a difficult word because I feel like help connotes that there's this and this.
Yes.
But I mean to be of service to individuals and families to become self-sustaining. I think that's really what it comes down to.
I think that's a wonderful way to look at it. We're about 15 minutes into our show, quarter way through the hour. Why don't we take a break?
Okay.
This is Healthcare in Hawaii. Josh Green. Today I'm joined by Rachel Wong, our new Director of Human Services. Thanks for joining us.
Aloha, I'm Hunter Hevlin, host of Sustainable Hawaii here at ThinkTech Hawaii. You can tune in every week on Thursday at 2 p.m. to see interviews with sustainability professionals from around the state and even further abroad, learning about activities with water management, food security, waste management, and a whole host of other fascinating opportunities to get engaged with making a greener island. So if you're interested in making the transition from consuming individuals to communities of producers, check us out every Thursday.
Aloha, welcome back to Healthcare in Hawaii. I'm Josh Green, emergency room physician on the Big Island, state senator, chairman of the health committee. Today I'm joined by Rachel Wong, who's our new director of human services. She comes from the Healthcare Association in her previous job. She has extraordinary education and credentials. She's got a heart of gold. She has been on the other side of healthcare. She dealt with a chronic disease that made her rely on healthcare services in our society. So she knows why we do these things for our people. She knows what matters for people in Hawaii, and she wanted to come home. So here she is. She's been nominated about 4 weeks ago, and my goodness. So yesterday, David Ige gave his state address.
Yes.
I thought he did a very good job.
Yeah, I think so.
David has been a colleague for years.
Mm-hmm.
And now he says, directors, cabinet, have at it.
Mm-hmm.
You have one of the biggest departments, as we described. I think you told me before our show, 2,300 employees work with you. $3 billion of the state's budget. Biggest?
About a quarter.
About a quarter?
Right, yeah.
Holy cow. Okay.
Yeah.
So, and those dollars are used in a wide variety of ways. Why don't we talk a little bit about that?
Sure.
Because I think that's going to be, this is your job, right? You're going to set the priorities with the governor on how we help people best we can, and how we maybe even change that paradigm and make the system just better for people so that they can avail themselves of what they need. What's your vision?
I appreciate you giving me the opportunity, to share this, and it might be interesting to come back to it, in a couple years.
Yes.
Right? But right now, where I'm at, 4 weeks into this job, right, is really, part of it comes down from what the governor is advocating and leading for.
Right.
So for us to look inside of our own department and to streamline, to see efficiencies where we can do a better job.
Yes.
But foremost, and I think I already touched on this, is that our department is here, Department of Human Services, and our administratively attached agencies and commissions. I didn't mention that.
No, that's...
So the Hawaii Public Housing Authority, the Office of Youth Services, the Commission on the Status of Women, and the Commission on Fatherhood.
Wow. Right?
So you're thinking that adds even more depth and breadth, right, to what we're all collectively doing.
Right.
Right? This department exists to provide the foundation for our communities, right? Working with other departments, Department of Health, Department of Transportation, Department of Education, cities and counties, right? Is to provide the foundation for a healthy community.
And that's what David was speaking about yesterday. Governor Ige, he spoke, and his main theme was home, building our home. And in many ways, it didn't dawn on me yesterday as I was sitting there watching the State of the State address about what it would mean to have you on the program today, because in many ways, the Department of Human Services is the most foundational department.
I think so.
I think it is because, look, you could make a case for the Department of Education. Obviously, we send all of our children to school. It's the bedrock of society, right? Getting people educated, you and I, medical degrees and PhDs and all this stuff, right? Masters and all. But truth be told, you're taking care of people and many needs that come to the fore from infancy. About parenthood, like you said, about fatherhood. So this is the foundational department. So it's going to be up to you with the governor to decide what is that foundation. So what kind of foundation do you want to build?
So, we talk a lot about in public health, what are the social determinants of health? And when I've been on the outside of government, it's been very clear to me that one of the predicting factors, right, on health is poverty.
Yes.
Right? I mean, you know this through everything that you see in the area that you live and the people you serve, right?
Right, absolutely.
Poverty is one of the most, across the board, social determinants of health.
Right.
And this is the community whom we serve, right? So what can we do to maximize the federal funds that we can bring in, right, to provide innovative programs that are building on what we've already been doing,
right,
but to find the overlaps and to see, how can we how can we truly help individuals and families become self-sustaining? And I know I'm talking very abstractly and broadly, but that's kind of where we are right now. You know, it's different coming from the outside, from the provider point, and coming in. And remember I talked about earlier when I was at HAH, part of the role of HAH is to advocate for adequate reimbursement rates for providers to provide quality care.
Right.
That's also my belief here, right, within DHS. But it's also understanding the larger construct of this austere budget, this time in which we live right now.
Yes.
So how do we all become more efficient, right? When we talked about the community health needs assessment work that that I led at HAH, it was a beautiful example of a partnership between a private community with a public one, with Department of Health.
Right.
So there are these opportunities where we can work together, right? To be able to actually move the needle up.
Well, it's really interesting what's happened too, because we've got I don't know if people are aware of this, but so you've got the governor comes in from the Senate, right, after all these years, watching things and seeing, David's very he's very contemplative, right? So he thinks twice before before speaking, and he measures twice before cutting. And then he picks you, who comes from the private sector,
who he didn't know.
Exactly, but he knew you had the right the right vibe and the right experiences. He's done a great job of picking people with incredible experience. From Healthcare Association, and you came very well recommended, of course. And then Dr. Pressler, Ginny, comes over from Hawaii Pacific Health, and she was in public sector with us in Department of Health for a while, but been many years, and now she's coming from the hospital side, so she really has been immersed in what the hospitals do. And now the two of you are very likely to be partners.
And we are partners already.
Tell us about that, because historically, I've known several directors of health and several human services directors over my 10 years in government, but I'm not sure I've ever seen them in the same room, if I think about it. But I have a feeling I'm going to see you two in the same room talking about issues. What's your relationship likely to be?
I think it's, it's a relationship that has continued, right? The fact that we could grab lunch together yesterday. And it's been built on texting back and forth until January 1st saying, can't wait to work with you.
Yeah.
Right? So it's a history, it's not a relationship that's new. It's one that's building on, where we, to be honest, with the flurry of everything going on and with the ledge having already started, we haven't had the opportunity to actually sit down and map out where are the overlaps, where are the opportunities.
Yeah.
Talking about behavioral health, that's a top priority for Ginny and for DHS over here.
Yeah, it's really, I'm so pleased you said that, because I was with Ginny this morning and her deputy, just because that's the way these days work, right before the legislature gets full tilt going. But last session we had this enormous amount of work that everyone did together, which I think brought some good ideas to the fore about the Hawaii State Hospital. Their challenges. But every patient that ended up in the Hawaii State Hospital virtually had some combination of life catastrophe, serious chronic illness, combined with mental illness and major challenges, and or drug addiction, right? And almost all of them had some significant combination also from the social determinants of health, as you've mentioned a couple times. And so people came from the community that you will be providing a lot of attention and work to support. And there we have Ginny, responsible for the Hawaii State Hospital and that part of her Department of Health, which I've heard from past directors of health that can consume you, that division alone. But now you guys both know these issues, and it seems to me like we may have a very good situation brewing here, where you can have seamless discussions about where Department of Human Services efforts lead into Department of Health Services and back again.
Right. We're talking about building continua.
Yeah.
I mean, I think, rather than being siloed, rather than being department by department, we're looking at overall community. And I don't think it's just particular to DOH and to DHS working together.
Right.
I got to say, our first cabinet meeting, and if you were a fly on the wall, I felt like it was a college reunion.
That's cool.
Yeah. And we had never met each other before.
Amazing.
So for me to say, hey Josh, I'm DHS. Oh, you're Ledge? Awesome. Nice to meet you.
Yeah.
I can't speak for what other first time meetings have been, but it was really that sense of enthusiasm and shared values and moving forward together.
You're going to have a very interesting and I think enjoyable ride. probably the experiences you're going to have with this cabinet of really terrific people. I have to say, David's picked a lot of great people. The challenges are gigantic, okay? For one, there have been just far too many cuts in health and human services in the last decade that we've endured, and it's been very frustrating for someone like me who, my first job was a community health center doctor, right? So it was all cuts. We had nobody, it was just me and a couple terrific nurses and staff, but for thousands and thousands of people. And that in many ways is what it's been like, I think, for the directors of health and human services, where so many valuable things to do, so many terrific people and ideas, and so little capacity.
But there's great opportunity. Right. So you asked me what's my vision.
Yes.
I see our department as an innovator, you know, as a bold leader, being able to, and I say bring back Hawaii to a time, you know, where we were creating those programs, and we can't create programs anymore, right? I mean, we know the budget constraints.
Hey, if your idea is good enough, just sneak it over, and we'll try to sneak it in somehow.
No, but what I was going to say is, we're developing new templates and models and paradigms, right?
Yeah.
I'm going to be making the asks of those in the private sector to partner with us, to do this together. Because it's not either or, it's us working together. And an example I want to share is, and this isn't quite analogous, but when I talked about unveiling the curtain behind, you know, behind the Wizard of Oz, right? To be able to say this is what happens. It's not just to say this is how this decision was made. It's to have actually an engaging and ongoing conversation with those in the community whose lives these all affect. So that we can get input and we can have a dialogue back and forth. And the example I use is, before I came on, I mean, it was the first day they came on, I got a bunch of communications, and it was from leaders from the COFA community. You know, great concern, right, about the plan, the Premium Assistance Program, right, which transfers folks from the COFA community, individuals, 7,500 individuals, from MedQuest, from our Medicaid program, over to our state exchange, the connector. Great concern about how is this going to happen, you know, what's the feasibility, what's the plan. So we had a meeting. That I think it was my first full week on the job. We had a meeting, we hosted it, offer was extended for leaders from the COFA community to come, and they came in the same spirit which it was offered. We had the heads of the connector, the head of our Medicaid division, MedQuest division, and we had a dialogue. And we got to hear from every single person who attended concerns, fears, and suggestions and recommendations. And I said, this wasn't a hearing. This is a conversation. For sure.
Your approach is much better than a hearing, no doubt at all.
And so for folks to understand, and for me to say, you know, I didn't understand how this program came to be. You know, and this is the process, and the reason why it's here was to make sure that there wasn't a loss of coverage. And so for us to have this dialogue on equal footing resulted in a lot of questions, just logistical questions. Do you need this form? How do we access the portal? What are we doing? So as a result of that, there have been weekly update calls that are open to everyone in the community, where folks send in questions ahead of time, and you know, they get answered there, and then it's open dialogue back and forth. And we're doing this in partnership with the connector, but it's because this government now, this government's, this administration's commitment to open communication and transparency. And I don't just say that as a head.
Well, you are a fresh face 4 weeks in, you know, and I think it probably will continue. I tell you, you actually and I've liked each of the human services directors I've met, but you are definitely, you have a special positive vibe that you're bringing to the job.
And you got to say this on air, but thank you.
I'll badmouth you afterwards. But I think that the challenges are large, and a lot of people just come with a complaint and a concern, but to be able to produce some kind of confidence that we can deliver these services and they're meaningful and that we're listening to people, it's going to go a long way, because it's pretty complicated stuff. It's been complicated for me, it's been complicated for you, our friends at the Healthcare Association. I mean, these are really big programs. And so I can only imagine if someone's, you know, uses English as a second language, or they've been a recent immigrant, or if they're really suffering with a major health problem, that's no time to be trying on your own to navigate government.
And I know that,
And so, bringing that to the table is going to be phenomenal. Well, why don't we take our second break, and then we'll come back for 15 more minutes of discussion. Okay.
Thanks.
I'm here with Rachel Wong. This is Josh Green, Chairman of the Health Committee. She's my guest, and she's the new Director of Human Services.
Hi, I'm your host on ThinkTech Asia, Bill Sharp. I look forward to you joining us each Monday between 4 and 5 o'clock when we film right here in our studio in downtown Honolulu. The show, ThinkTech Asia, focuses on contemporary events in Asia. And by Asia, we mean anything from Hawaii, south to Australia and New Zealand, west to Pakistan, and as far north as the Russian Far East. Clearly, this is one of the most economically dynamic centers of the world, and we bring you up to date on what's going on in a whole host of countries in this very vital region. We look forward to seeing you. Aloha.
Aloha, Yappers. This is your host, Kingsley, for the Yap Show. Every Friday, 3 p.m. to 4 p.m. Eastern Time. You can catch us here live, ThinkTech Hawaii, and then later on, we upload to our YouTube channel. We talk about youth issues, policies, youth programs, and how to transition yourself into adulthood.
But this was like a sign, I guess. Hey, Mike's like, hey, right. Now's your chance to go back to school, which I'm doing.
Catch us here again live, 3 p.m. to 4 p.m. Hawaii Standard Time. Aloha.
Aloha. Welcome back to Healthcare in Hawaii. I'm your host, Josh Green from Big Island in the Senate. Today I'm joined by Rachel Wong, our new Director of Human Services. She's kind of a bright light in the room. She's worked at the Healthcare Association. She's worked on the community needs assessment for that organization at the Healthcare Association. So she's got a really extraordinary grasp of where we are as a state on health issues and human services issues. And she's had a trial by fire. She's only been in the government, in the administration with Governor Ige for 4 weeks, but she's hit the ground running. She's already meeting with community groups, with large organizations that have a big stake in how we do as government officials. And she's here to solve problems and talk about the department. So when we were talking earlier, Rachel, about your early impression, you told me that there's just so many good people at the department and so many good things. Why don't you give me some examples so I can know better? Let me learn from you about some of the things that the Department of Human Services does that you're proud of already.
Sure. No, you know, just this morning, I was down visiting with our eligibility workers in a MedQuest division. You know, and to see the faces and the people who are doing this job. And you know what? To hear directly, time and time again, the reason why people are in these roles, it's because they really care about that one more person getting healthcare coverage.
Right.
And that's not what comes out, right? You know, what's in the front page and everything is COLEA, our Medicaid eligibility system that's online. You know, that works. The system works.
Yes.
And it's the people who feel the brunt of when people complain about the tweaks that we're making or that we need to make.
Yeah.
I have just been continually affirmed by folks that I'm meeting who are in the trenches doing the work. Folks have had, 30 years, in our department. Folks who are leading divisions or offices. I mean, good people. And I think it's pretty clear nobody goes into this work to make a lot of money.
Right. No, it's really, really hard work. And I think that what people might not realize, maybe they're realizing today as we speak about it, is that when someone is interfacing, by the time they're interfacing with you or a caseworker or social worker or someone doing eligibility to help get a Medicaid insurance plan together for somebody, the person's really probably hurting. And they're going through a lot of tough stuff. And so you have someone who's decided to commit themselves to work in the Department of Human Services for a small state here by ourselves, interfacing with somebody who's really having a tough go of it. And that sounds to me like a recipe for a lot of challenging work. So what's it like for those people? Tell me, you saw them working there and signing people up. It seems like a big challenge. How do you do it? Do you have enough people? Where do we find the resources to do these jobs?
Yeah, no, you're asking the questions right, from your vantage point.
I wonder anyway, because when I see someone in the ER, if they come in without insurance, I immediately say, look, first of all, let's forget about that. Let's just take care of you. They get better, knock on wood. But then I realize if they don't have any money, they're going to be devastated if they get a bill. And so there's a paper that comes from the Department of Human Services that I get to fill out as a doctor that says, this is urgent. We must take care of this individual right now. Check a few boxes, and then it gets to you. And I know that within 3 or 4 days, that individual, as long as they follow up, will be able to get coverage and get through this tough period without losing their car, not being able to ever afford a house again.
Those tipping points in one's life.
They have kids,
right?
you know, and I don't want their kid to God forbid, not be able to afford medication. These are
Yeah.
really important things, and I think when people dismiss programs, they're not asking the full spectrum of questions. They're not saying to themselves really what's good for all of us. Because if one person in the community is suffering terribly and everything collapses, it's going to it's going to affect everybody. So
That's
you're
right.
taking care of individuals that are in this boat.
Well, and we are all taking care
Yes.
of each other,
Right.
right? I mean, I think that I said that, it comes down to people.
Right.
It comes down to the individuals and families, and both ways. It's
Yeah.
individuals who are working the phones, behind the computer, behind that eligibility
Right.
counter. And I think that's what I want to portray is that one, or convey,
Yeah.
is that one, great people doing tremendous work. And two, for folks to understand that they're committed people who feel very deeply
Yeah.
about the work that they're doing.
Yeah, I think maybe what you're saying also is if people should be patient, because with good-hearted people on your staff that you're describing, it's going to get done. Like, none of us are perfect.
Right,
Me
right.
first, okay?
Yes.
But it's just, I think if we're patient, we can, that doesn't mean we're not going to troubleshoot the things that we ourselves know we could do better. We've had the connector guys on, and we've got the word from them that they're fixing what they can, and you've mentioned Korea and other, other places where we can always do better. But if we're patient here, and there's no one coming to our rescue in Hawaii, there's no
That's right.
stallion that's going to just buzz
That's
in
right.
and solve all our problems. It's us at
Yeah.
this table and a couple other rooms around the town here in Honolulu. To try to come up with solutions. I think that if people are patient, they're going to be very happy with you as a director. But you have so many, you've worn so many hats. What do you think you're going to focus on in the first 3 months? What are your areas as you learn this giant department? Do you have a feel yet for what kind of things you'd like to do out of the gate?
I can share two primary things.
Okay.
One is a people thing.
Yes.
One is to I obviously wasn't brought in for my content expertise. I don't know, I don't know human services policy, right? I've interacted with MedQuest because of my experience working in the healthcare system.
Right.
But I was brought in for the people aspect of it,
Right.
right? To nurture, to rebuild partnerships inside and outside, right? And to heal, right? I think we can both share here and with whoever is watching that, we've been through tough times. Our state has been through really tough times.
Right.
And you alluded to the fact that, there's 2,300 people doing jobs, but we used to have 3,000 people doing these jobs.
Right.
So loss of people, loss of colleagues, loss of human resources, that's a lot to have to overcome. That's the dedication of the people who are here.
Right.
Right? There's been, tough times, right, at the ledge with community partners, with all these different moving pieces.
Right.
So that needs to be rebuilt, and we need to figure out how to work together.
Right, and
So
you
that's-
already are working with some of the private sector in a very good way. And I wanted to just riff on that for a second before you
Sure.
give me the other priority that you're working on, because I think that's such a smart approach. What people don't realize is if we don't support those who are really having a bumpy part of their lives
That's
and
right.
needing help,
That's right.
if we don't support them, they're going to have needs anyway.
That's right.
And they're going to end up in the hospital or dropping out of school and needing additional assistance, or God forbid they run into real big challenges in their life and are desperate. And we see that all the time. And then we'll be cleaning up messes that we could have actually been lifting people up in a good way.
Yeah.
And when someone ends up at the hospital over and over and over again because they're homeless and they have health conditions that have gotten out of control and they, their life has collapsed in some other way, it's very expensive and it's not efficient.
That's the end.
Right, that's the end game.
Yeah.
And they had this middle game, which was just really tough for them, and it
Yeah.
was tragic that they suffered. You're working out front here, which is to try to help people now, and that's a great place to be, because with these partnerships that you're bringing in, I think Queens and the Hawaii Pacific Health of the world and the rehab hospitals, they realize that not only are you a good person and a good person to work with, but if you can succeed in partnership with the private sector, they will also probably even do better.
Yeah.
Because they won't have to deal with the crises
That's
on
right.
their doorstep.
That's the goal. That's the goal. I don't think you asked this question, but others have certainly asked me this question. Why did I agree to this role?
Yes.
I was asked to apply for this role, right? And I said, and it's very clear to me, because there's the potential and this huge opportunity
Right.
to change the trajectory of our future generations, right? I mean, this is our home.
Right.
This is the time that we can collectively do this.
Right.
And do we have time for me to tell a quick story
Of course.
that ties it together?
We do, yes.
I have a friend who used to run, she started this program in Mbarara, so it's outside of Kampala, Uganda, where HIV/AIDS, you know, the rates are, it affects every family.
Of course.
And what they've done is they found the leverage points in the community to make sure that there's this, you know, continuum of care,
Right.
or more that people are compliant and receiving care. But it's not because it's through opening a new clinic. It's not because it's adding more docs or healthcare providers. It's one, finding out transportation was the issue, right? Because you have to save up enough money to be able to get a car rented, take time off from your job to go to the clinic.
Right.
So providing transportation was one. Two was engaging everybody, right, in social capital. This affects all of us.
Right.
If I'm sick because I don't take my meds, then I got to ask my spouse to take care of me. That means my spouse or partner is not working.
Right.
So then we got to ask the neighbors to help us with food. So it became this whole social capital thing where everybody's involved. So when the roosters start crowing, the radio stations start playing "Time to take your medicine." Everybody take your antivirals. If you don't feel this responsibility to take your antivirals, right? If you don't, then it ripples out.
Yes.
They have got, this was 5 years ago that I was talking with my friend about this. They had their compliance rate up to 99 point something %. And not just compliance rate, you know, taking it twice a day, it was within 5 minutes of every 12 hours.
Wow.
And if they can do this in a rural area because of the interconnectivity of community,
Right.
why can't we do that?
Yeah.
Right? And you're talking to me 4 weeks in where I come in with these big, you know, idealistic goals.
That's what we want. You
But
know
that's the vision.
Yeah, I'm so, you know, as you were telling that story, I was thinking, because when I graduated from med school early,
Right.
a year early, and so I went to Swaziland and worked, and
Right,
58%
I
of our
forgot that.
people, you know, that we were working and taking care of were HIV positive. 58% in that
Yeah.
little, in that
Every
community.
family.
Right, so every family, and so really half of our hospital was a hospital, and half of it was an orphanage, right? Because so many great, sweet Swazi people died,
Yeah,
you know?
yeah.
And I just remember how devastated that community was because there was nowhere to turn, no help to get on any level. But the world's changing now. And obviously the story that you tell of your friend in
Yeah.
Uganda, there are solutions. And
There are.
that's really encouraging to see because I think that a lot of people in the world now have become so frustrated and jaded that they think there aren't any solutions left out there. You know, we see Boko Haram and we see horrible
Yeah.
things that occur in Nigeria and we see horrible things that occur, gosh, you know, in Mississippi and even here, you know, whether it's in Ka'u or Waianae, tragedies occur. But there are solutions that are available to us. And I think it's, to be honest, fresh minds that just might bring them, you know, bring those ideas forward. So it's you
Yeah.
that it's going to have to be,
Oh,
the
the
fresh
team.
mind.
Yeah,
So
yeah.
we've got another minute or two.
Yeah.
What else would you like to tell the people of Hawaii before we wrap? What would you like
Well,
to tell your people at the department
Well, I
even?
wanted to finish too, and also say that, you know, in addition to the people part of it, it's also looking at our programs to see where we can be more innovative and where are the overlaps and where are the opportunities to be more efficient. And the third part is our infrastructure, right? So it's building that IT platform so that we can have a single way for people to determine eligibility to come in. And that's in the future, but we want to be able to share that with the rest of the state.
So you're going to mix roosters and programs with high tech.
That's right.
And the Department of Human
That's
Services
right.
is going to thrive.
Yeah. And I want to say, you know what? I'm just really, really honored to be in this role, working with these great people, to get to work with you in this new capacity. I mean, I think we can do great things.
I think so too.
Yeah.
Well, this is a great place to end, I think. It's been an extraordinary 45 minutes. I've been here with our new Director of Human Services, Rachel Wong. She brings kind of a bright light and a positive perspective to the department. I think we can expect great things. This has been Healthcare in Hawaii. I'm Josh Green, your host, with Rachel Wong. Thanks for joining us.